Started. Welcome everyone to this week's installment of AMSSM's National Fellows Online Lecture Series. My name is Matt Wise. I'm an assistant professor at UT Southwestern. Before we get into our topic for tonight, I want to remind everyone of next week's lecture on ligamentous injuries of the ankle that will be given by Dr. Kathleen Davenport 1 week from today at the same time. Moving on to tonight, I'm very excited to welcome Dr. Monique Burton to speak to us on performance-enhancing drugs in the care of athletes. Dr. Burton graduated from Temple University School of Medicine and then completed her pediatrics residency at UCSF prior to doing her sports medicine fellowship at UCLA. She is now an associate professor and director of sports medicine at Seattle Children's Hospital. In addition, she works with fellows at the University of Washington's Primary Care Sports Medicine Fellowship. She also travels as team physician for USA Track and Field and chairs the USA Track and Field Sports Medicine and Science Committee. Before we get started, we also like to mention the goals of the National Fellow Online Lecture Series, which are to serve as an adjunct to your individual program's educational content, to provide fellows with direct access to educational experiences with AMSSM members and at times invited guest experts, and most importantly, to assist with CAQ exam preparation. And lastly, some reminders to please mute your device's microphone and turn off your video, to submit questions through the chat function. I, as the moderator, will ask the questions during the Q&A at the end, and to please complete the evaluation that Andy will put in the chat at the end of the lecture. And now, without further ado, welcome Dr. Burton.
Thank you. I'm going to share my screen. Okay, perfect. Are you able to see that? It was a little bit scrambled for me before on the other one, but that looks good. Okay, let me just move this over. All right, so tonight we're going to talk about performance-enhancing drugs, and I put helpful things to know. And I really would like this to be, we're not going to go through every detail of every drug because that's, well, quite honestly, a little bit boring. But I want to make sure that we talk about the things that are relevant to you as clinicians and as you're moving into your positions outside of fellowships, so that you're aware of things to be looking for in your athletes that are participating at elite levels and at the Olympic level, but also, you know, assuming who may be emerging in that way. So, okay. There we go, no disclosures from me. So our goals will be to go over a little bit of the background, review the WADA prohibited substance list, the 2023 modifications, and there's actually just recently came out with the 2024 ones, the sample collection process, TUEs, how violations work, how you are as a medical team, medical provider participating in this, and some resources. So this is like a little bit of alphabet soup, and I am not going to read all of these things. Hopefully you can review these at some other time if you want all the details. And these are certainly like on the USADA website. But I found that it was really helpful to understand there's so many like USADA and NATO and like all these different things. So kind of to try to give a little bit of a background of like, just what is that? So USADA is our national anti-doping agency, which is our NATO, for Olympic, Paralympic, Pan-American, Para-Pan-American sports in the United States. And so they are the ones who manage the anti-doping program, like the results, the processes, the resources. They're a huge educational body as well. And they help the national governing bodies, the NGBs, as well as the USOPC with the drug testing. It's the organization that contributes to advancement of clean sport, lots of research as well as education and outreach. It's also important to know that USADA is not a government agency, which I think a lot of us could have thought that. WADA is the World Anti-Doping Agency and established in 1999. It is the international independent agency that is the collaborative worldwide doping, anti-doping and doping-free sport organization. And their primary role is to develop, harmonize, and coordinate anti-doping rules and policies across all the sports in all the countries. And so they're also doing science research, education, outreach, developing policies. They also make sure people are compliant with the program. The World Anti-Doping Code See, again, there's just like lots of different terminology. So I think it's helpful to kind of just understand where this all comes from. The World Anti-Doping Code comes from WADA, and it's that document that provides the global framework for anti-doping models, rules, regulations within sports and organizations. And so they're basically what's bringing together all of the different anti-doping agencies throughout the country. And so they work in conjunction with the international standards. And there's this World Anti-Doping Signatory. And to be a part of that, the organization has to fully accept the code, the anti-doping code, and meet certain standards. And so that's an important aspect of that. You want to be compliant and in the appropriate standards to be part of WADA. There's also the WADA prohibited list every year. So annually, there's a prohibited list. It helps identify substances and methods that are prohibited in competition as well as out of competition. It becomes effective on January 1st of each year. And as I just mentioned, we'll talk about this, it's released around this time-ish for the following year. It has, what it includes are things that are either performance-enhancing substances or things that represent a potential benefit in performance enhancement, and also just things that violate the spirit of sport. I think that's actually an important one because I think we only think about things that are prohibited as far as substances, but there's also things that are not in the spirit of sport, as they say. So again, we are not going to go through each of these. I'm going to try to highlight some of them so that we can spend more time just kind of talking about the logistics around anti-doping. But the substances and methods that are prohibited at all times are divided into these categories. So there's the non-approved substances, anabolic agents, peptide hormones, growth factors. And I'll hide my screen so that I can actually see what I'm telling you guys. Really, it's growth factors, related substances and mimetics, beta-2 agonists, hormone and metabolic modulators, diuretics and masking agents, and then these other prohibited methods. Non-approved substances, so let's talk about that for a moment. These are things that are prohibited at all times. So these are any pharmacological substance that's not addressed in any other section. There may be just not current approval by any governmental regulatory health authority. And some of those examples are drugs that are in preclinical or clinical development, designer drugs, substances approved for only veterinary use, or BPC 157. So there's always new things that are adding to that, right? Because these are things that may not meet a category, but they need to live somewhere so that they are, so that we're realizing that they're important. Anabolic agents, I think that this is probably what we think of. When we think of prohibited substances, this is pretty obvious. These things are not permitted for many reasons. So we think of our anabolic androgenic steroids, like anti-aging and hormone replacement therapies. You see testosterone on there, stanozolol. They all have fun names too, really hard to say. Other anabolic agents, and this is not also, so not completely comprehensive. I just chose ones that I think that we see and we hear about more. So those are also in that category: the SARMs, the clenbuterol. Moving on to the category of peptide hormones, growth factors, related substances, and mimetics. Again, these also prohibited at all times. Those are your EPO and agents affecting erythropoiesis. So obviously EPO. Your hypoxia inducible factors, and those are things like xenon. Then moving on to the peptide hormones and their releasing factors, that's HCG, human growth hormone, and then in the category of growth factors, that's insulin growth factor 1. As far as beta-2 agonists, these are also prohibited all the time, but I think this is an important category to understand and know a little bit more about, because there are some things that are exceptions that we'll talk about that are really important because they're necessary for some of our athletes. So these are terbutaline, salbutamol, clenbuterol, and I can't say that properly, but hygenamine. So the exceptions are inhaled, and I'm not going to go through them all, but I think that what's important to see is exceptions come in the form of that if you're taking something at an appropriate dose for the medical problem, it probably won't exceed the amount that you can have, with the exception of if something is continuous. And if that's continuous because it's necessary, we'll get into this, but that's something that you can get appropriate documentation for. Try not to say what it is because we're going to get to it. But basically what it's saying is that these substances can be abused, but if they're used properly, then they're not in abuse range. And if they're needed in a higher dose, then you'll need to have proper documentation that they're permitted. So one thing that I think is actually important to note down here is that if there's the presence of salbutamol in the excess of 1,000 nanograms per milliliter, and it's or formoterol, and it's not consistent with a therapeutic use, then it would be considered adverse. So basically, it's saying that like you need to have a reason for using these substances that is medically appropriate. Moving on to hormone and metabolic modulators, again, also prohibited at all times. I'm just going to highlight a couple that I think we will hear about, like clomiphene. Some of these I think are going to be evaluated, and they have like some types of modifications or exceptions to them because some of them are used for appropriate reasons, but that's just we'll get into that and how you are able to take those. Some of these, probably never heard of, big fancy names. Diuretics and masking agents, and I'm going to highlight one on the list, and you probably see it that you really want to be mindful of. So these are things like desmopressin, acetazolamide, and note down here spironolactone. And as somebody who's in the world of pediatric and adolescent medicine, this definitely comes up. If you follow anti-doping and on USADA website, you can actually see where they've listed violations that have come up. There's been a couple recently around diuretics. Why? Because sometimes people use it for what? I'll say, because I can't see you guys, but this can be used for very normal things that people use in their life for like skin and other things. So it's just an important thing to know when you're working with athletes. There's certain things that are not permitted because they can be used as a masking agent. So these are some exceptions over here on the right side. But again, look at this note. I think that's really important. So detection of any quantity of formoterol, salbutamol, any of those beta-2 agonists in conjunction with a masking agent is actually just prohibited. And the reason why is because then you're no longer using it for, well, the suspicion is right that you're no longer using it for a medical problem. You may be using it as a masking agent. I think that's just important to remember when you're prescribing things and understanding the level of competition of your athletes, so you don't unintentionally provide them with a medication that is not permitted. They have been taught, and they should know that they should always be mindful what's in their body. But some people who are just getting into the more elite world, and some people who are, quite honestly, just not necessarily paying attention to that and assume that their doctor would know, are people who can sometimes get into trouble with that. Manipulation of blood and blood components, these are prohibited at all times, including blood transfusions. Obviously, if you need a blood transfusion, then you get the blood transfusion. This is meaning people who are using it for doping reasons. And then we'll talk about boosting later. Oh, right now we'll talk about boosting. So what is boosting? It's not specifically listed as a prohibited method because you won't necessarily know if somebody's doing it, but it is a performance enhancing method. It's utilized by athletes with cervical or high thoracic spinal injuries to overcome loss of endurance and fatigue that's caused by dysautonomic disorders. And so the idea is that it does give a performance benefit immediately before competition by increasing heart rate and oxygen uptake, and then ability to perform better for longer. So deliberately induced autonomic dysreflexia is by introducing a painful stimuli to the lower body. So some things that sometimes athletes will do will be blocking catheters, excessively tightening their straps, or sitting on sharp objects, and then that will induce this. So things that as a provider, if you're working with a para athlete, that you might want to look for is like, is their systolic blood pressure rising? Do they have a pounding headache, a low heart rate? Certainly these are things that you would want to be mindful of, period. And if they were having that from not an intentional inducing it. And so those are things that would be important. But if you notice that, then certainly they can get into trouble by trying to induce this reaction. Obviously, serious consequences like seizures, MIs, pulmonary edema, hemorrhage. So this is not something that is the practice is not permitted, but you would have to recognize it. And then thinking about chemical and physical manipulation. So I think sometimes we think about like performance enhancing drugs and all those things that we know that are prohibited, but also like things like not allowed to tamper or try to tamper the sample. And then here's like a really important, interesting one, IV infusions. And so sometimes our athletes are receiving like vitamin infusions. And a really important rule is that they cannot have more than a total of 100 milliliters per 12-hour period total. Like, so sometimes people will think like various things are under 100 milliliters. It really is a total. We've seen people get in trouble for this by posting like lovely images of getting infusions online, because I think a lot of times that ends up coming up. So just being really mindful of that in your practice, if you have an elite athlete that may be in the drug testing pool, and also making sure that they're aware of that. Obviously, gene and cell doping prohibited at all times. These are like things like genetically modified cells, nucleic acid and nucleic acid analogs that may alter the genome. So like gene editing, gene silencing, gene transfer technologies. You can imagine like this is just going to get really tricky to detect over time, because these things, you know, how do you do that? But the spirit of sport, again, thinking of that, these are not prohibited, not permitted. Okay, and then substances and methods that are prohibited in competition. So some of these may be allowed outside of competition, but in competition, we're talking about stimulants, narcotics, cannabinoids, and glucocorticoids. So as far as stimulants, again, these are not everything. These are just ones that I highlighted. And no, cocaine not permitted during competition. It seems like an unwise choice, but certainly something to be mindful of. And then, but then things like ephedrine, epinephrine, you know, some of these things may actually be medically appropriate if there's this condition that's going on. So just being mindful of that. But some of them seem really obvious to me, like, why would you want to do that if you're competing? But just being mindful of that. And then look at these exceptions. So that's an important thing, that some things are still being monitored for like what impact they may have. And sometimes they're actually medically needed, right? And some of these like ophthalmic and otic uses of them are actually necessary, and they may be things that you would think of not using otherwise. Narcotics, and so these again prohibited in competition, things like heroin, fentanyl, hydromorphone, methadone, morphine, and oxycodone. And more on that in a moment. So cannabinoids also prohibited in competition. We know this came up and was controversial, certainly in a sport that I spend time involved with, and we'll talk a little bit about that. So the exception is basically CBD. The trouble with that, right, though, is that how do you know that that is truly pure? And that is really, really important for several reasons. One is unintentionally having a substance that you didn't think was contaminated in with a product that you're using. And certainly when traveling internationally, these are things that are really important to avoid, because the rules in other countries are very strict. And we just recommend do not even go down that pathway of CBD, because you may be unintentionally bringing something in. And if you do that in another country, their policies may also not allow you to get out of that country and have significant penalties. Glucocorticoids prohibited in competition. We're talking about things like betamethasone, cortisone, methylprednisolone are like, are steroids that we may use. And certainly these are something that are relevant because they may be used as part of joint injections and other procedures. So those are allowed when you're outside of competition. And so one of the important things, and especially thinking about athletes who may be dealing with some type of injury, and they may be thinking about having some type of injection, of making sure that they're mindful of the washout period and whether they would need to have a appropriate TUE vial. Mostly it's related to the washout, I would say. Be mindful of how the proximity to when they may be tested. beta blockers are actually interesting, right? So why would you want a beta blocker if you're participating in some sports? Well, some sports will benefit from the use of them. And so you want to be mindful of the sport and the type of medication. And this one, this is a medication that some athletes certainly may be on for medical reasons. And so making sure that if they're participating in a sport where there may be a competitive advantage, that you're really like looking to make sure that they have the appropriate documentation on file if it's medically necessary. So this is just kind of a summary of some of the major modifications from 2023. These are divided into those categories that we talked about. So not really any significant changes on the anabolic steroid side. They added a couple other things. Some of these, you can look into them more. They're on the prohibited list, and they have a really nice documentation of things that are like new. And USADA does a really great job of summarizing those. And those are for this year. These are just kind of continuing on that. Now, here's a little hint of something that is coming. Tramadol, prohibited starting in January 2024. I think that this is an important one since we know that it can be used often for pain, but that's now going to be on the prohibited list. And then we'll get to that later. So some notes on the cannabinoids, because I think that this has brought a lot of like conversation and controversy, and some people saying like, why isn't this going away, given changes in some of our states in our country? But I just want to point out a couple of things, because there are some changes that have been made. So THC is still on the prohibited list, but some of the changes that have been made, if you're looking at like here, 2013, the threshold has significantly changed as far as its limit. And so I think that that's attention to really understanding and making note of like, where is this violating the spirit of sport? That was in 2013. In 2018, they made it so that CBD was removed from the prohibited list because it doesn't have the psychoactive effect. And so, again, some issues with that still, right? Because you don't want to deal with that contamination, but I think it's still addressing that the blanket statement of nothing being allowed was broad, and now we're kind of really getting into that. In 2021, the kind of punishments or what the actions related to taking these substances have been changed. And so the prohibited period of time has been really changed over the time to be less significant. They still lose their medal or prize or result, but the length of time that they may be sanctioned has decreased. So at this point in time, THC is still on the list because they really feel like there's not evidence that supports THC to be something that is, they feel like that it's still something that could be in violation of the sport. And there are some impacts that could be negative for the athlete. So that's also a relevant thing as well. So noting that like WADA is looking for things that violate spirit of sport, but also could have potential negative impacts as well. So maybe this will change, but at this point, this is where we are. So as far as the monitoring program for this year, these are some things that you'll see on there. So that's some agents. I will point out that still kind of looking into some of those beta-2 agonists, they're watching them. What that means is that WADA is really monitoring them. They're looking at them to see, like, are these substances that can be removed? Are these substances that are of concern? What do we need to like know about these, and how may that change the prohibited list? And then the major changes I kind of stated were coming up for 2024. This goes into effect January 1st, 2024. Tramadol now will be on that list. They noted the blood plasma via plasmapheresis will be permitted. So basically, this is making sure that if people want to do a nice humanitarian thing and donate, they will not be, that's okay. And they like specifically call that out. And then there's also some new washout period for rectal glucocorticoids. So just knowing that, especially if they're being prescribed for your athletes. Okay, so then let's talk about like, well, who gets tested? There's athlete testing pools. There's the registered testing pool, that's RTP. They're responsible for directly keeping USADA informed about their whereabouts. You may hear about this. This is like one of those popular conversations about the whereabouts, and the athletes need to make sure they are telling people where they are. They file that quarterly and they update it depending on where they are. There's also a clean athlete program, and that is like they have limited whereabouts, and it's part of the USADA strategic testing plan, and their whereabouts are less strict than the registered testing pool. I want to go over like the sample collection process, because many of you, if you involve yourself in sports that at the NGB level, maybe you're traveling with some teams, or you're part of an event that is hosted locally, then it's really nice to know what to expect in this process so that you can feel fully informed and you understand the rights of the athlete so you can be an advocate for them. So the sample collection process starts with a notification. They will be selected. It can happen in or out of competition. You typically would be involved in an in-competition situation if you were like at an event where they were doing it surrounding the event. Most likely you're not involved in competition testing that is actually at a home, hopefully not, but there'd be more that like sometimes before the actual event starts, there's some out of competition testing. And typically in that time period, you would actually consider that in competition. There's like a window surrounding that that's considered in competition. So most often you will be part of a process where somebody is in an in competition situation. However, in competition may also be that they're at the hotel versus at the venue. So they can test them without notice, anytime, any location. That's why you need to keep your whereabouts there. They will be notified by a doping control officer, and they will be informed of their rights and responsibilities, provided with photo ID. The reason I point these out is that you want to make sure that athletes are aware of that. They want to know these processes and procedures so that if they ask you about them and something was not right about it, they can ask about it, or they know that their rights to say, like, I need to see photo ID. When they're in the doping control station, then basically what happens is that following their notification, they will be under continuous observation. So what is important to know about this, and these are some important things as a medical provider, is that they need to report to the doping control station immediately. However, there are some circumstances that you want to be aware of. So, for example, in the world of track and field, especially in distance running, our athletes really like to have a time period where they can cool down, and that's completely appropriate and within their right, but they need to make sure that they have the doping control officer with them at all time. They just need to inform them and know that they're going to be with them at all times. And then as soon as they're done, they really need to report theirs promptly as possible. But some of these other things are part of the reasons that there may be delays. So they might be in another event, there may be an awards ceremony. Certainly if there's medical treatment or they need to have a representative, I think that's a really big key, is when you're a part of talking to your athletes and informing them, letting know they have a right to a representative. So if they say, you've been notified, let's go, they can say, I would like to cool down and I'd like to get my representative. And they just are accompanied for that. But I think really understanding that, because I think younger or newer athletes to this elite pool sometimes don't know that. So they'll just defer and go right away. And we'll see situations happen where, not cooling down may lead to some medical issues later, not getting proper like hydration, fueling, especially if they have other events. So, not being like contrary, but being within their rights to say, like, I like to have my, representative, I like to cool down, and advocating for themselves and you being an advocate for them for these processes. As far as the sample collection, they're going to provide a sample of urine. The athlete they'll kind of go to a table, they'll be able to select their own vessel. They should select it. They would have to indicate to the doping control officer if they wanted them to actually select it, but their hands are on their items at all times. The sample needs to be at least 90 milliliters, and that collection is under direct supervision. And actually that is not a place where you're watching. There's some exceptions to this, and I'll get into that. That comes up in a little bit. As far as blood collection, this is always I think really important to know, to be able to share with your athletes that they're not going to be fatigued or anything because of the amount of blood. It's 2 tablespoons. it feels like a lot, it looks like a lot. It's another anxiety provoking thing that may happen for them, but it should not affect their performance. They do have to remain seated about 10 minutes before they have the blood draw. So there's a little bit of waiting involved there, but typically they're filling out paperwork during this time anyways, and the blood will be collected by a blood collection officer. And they have a maximum number of 3 attempts, and then they'll collect the blood there. Usually at an event, the athletes and the team will be aware of what they're collecting, just so that you have some ability to have conversation and prepare the athletes for that experience, because obviously some people are needle phobic, and like there's opportunities there if you are traveling with somebody who's in sports psychology, or just somebody who's very calming for the athletes, to make sure that you have somebody who can support them if they have those fears. And this is actually newer, and I pointed out because you might see it. It's kind of interesting. It's dried blood spot testing, DBS, and basically it's a capillary blood. It looks kind of, I will say, like, it looks a little scary. So like, I think it's knowing what it is and knowing that it actually is not painful. We've had our anti-doping person do it, and they said that they didn't notice it. It looks like a little bit of a crazy contraption. So I can imagine some athletes might be a little apprehensive of looking at that, but they're hoping to be able to maybe move to doing this more often, so that there's, then you don't have to deal with a needle. It's a little kind of, you can see this device, it goes on the arm, and the athlete that I accompanied, when they had it this summer, they said they didn't feel it at all. They asked, they're like, is it done? And it was done. So more to come on that, I'm sure. And then the sample collection process is, from there, the athlete's going to select their kit. There's going to be some from them to choose from. They make sure that it's not tampered. There's going to be labels. You want to make sure the labels are matching, the stickers are matching everything that's on the box. They're making sure that those match the containers that they're putting their sample into. The couple just little things that I note is that there usually are extra stickers. If there's extra stickers at the end, I usually have the athlete keep those or tear them up, so that they know that there's no ability for those to be used somewhere else. And this is also hands-on by the athlete the entire time, unless they ask specifically for them to help it. And the person who they ask to help should say, are you giving me permission to be able to do that? And then once everything's sealed, they will then take that sample and appropriately store it. So then they will complete the forms. They'll give them a hard copy. Usually now they give them a QR code as well. They will, on these forms that they're completing, they're going to declare all their substances. They will note if they have a TUE, which we'll talk about in a moment, and they'll check everything very thoroughly, and then they turn in their form. Then the sample will be transported. It will be inspected, it'll be analyzed, and those results will be obtained, and they actually store the samples for future collection as well. So special considerations: a minor can be accompanied by an adult or representative. They can be in their washroom, but they actually kind of aren't visibly watching the athlete. So they can be there to be supportive, but they're not actually the one who's watching. The doping control officer is doing that, or if an athlete is impaired, and so they may need support. So TUEs, let's talk about TUEs. Really, really important thing to know. So what is a TUE? It's a therapeutic use exemption. It allows uses of medications that are on the WADA prohibited list for certain illnesses and conditions. So that's really important to know. It doesn't, so if you're an elite athlete and you need to take a medication, doesn't mean you can't take it. You need to do the proper documentation to be able to take it. So how do you know if you need to take a medication? What I would say is definitely take a look at the USADA website. Super helpful, takes you step by step through this process. You can check it out in advance so you kind of know what you would be looking at, but we'll kind of run through that. So you're going to see if medication is needed, and we'll talk about that in a second. You're going to see if your medication status is needing a TUE, and we'll talk about that. And then you'll be able to look and kind of see how that lines up with your being in competition or out of competition. And then there's a lot of details about how to fill that out. So I'm going to switch to another screen for a second. Hopefully this works. So how do you know if a medication is prohibited? There's a really wonderful site. I highly recommend just playing with it and using it. It's called Global Dro. You put in a medication, allows you to look it up, and you're able to see if it's prohibited in or out of competition. There's also a drug reference line. Let me show you this real quickly. I'm going to stop sharing this and jump to another screen. Okay, so how this works, hopefully you can see that. So this is global DRO. You go under user type. I'm going to select medical professional. I'm going to select, we're going to select track and field because that's what I do. The United States is selected there. And let's go ahead and select, I'm going to do 2. So we're going to select ibuprofen because, you know, that's super common. And we know that's not prohibited, but it's kind of nice to use as an example just to search. Okay, so you can accept that. Pop in ibuprofen. There you go. You get this great, there you go. In competition, not prohibited. Out of competition, not prohibited. Let's search albuterol. Oops. So if we go, we'll just select this albuterol. In competition prohibited, out of competition prohibited. It gives you these conditional things. That's what we'll get into. That's what you need a TUE for. And then I'm just going to search. These are some ones obviously I've searched before, prednisone, because I want you to be able to see what happens on some of these. So out of competition, not prohibited, in competition prohibited. And then it tells you kind of what to do. So play with that because it's a fun site. And honestly, what I do with this is that when somebody says to me that they come up to me and they say like, hey, can I take this medication, doc? I say, okay, let me show you this website, and we go through it and we do it together. I think it's really helpful to educate your athletes about where they can find that out, and they can put in there anything just to make sure that they're fine. Supplements. So what about supplements? We can never tell an athlete that a supplement is okay. They're always taking it at their own risk. But there are some things that I think are really helpful resources for you as well, the athletes to look at. Supplement Connect has some great information on there about supplements, ones that are higher risk. And then there's the NSF Certified for Sport, and it is the most ideal place to find supplements that are most likely to be fine. So this is a certification federation that is trying to reduce the risk of supplements, because, you know, there are certain things that people take, right? And almost ones that we recommend that are technically are supplements, right? Like iron and whatnot. So really guiding your athletes to look for an NSF certification, but always, you know, making sure that they understand that they're taking things at their own risk. This is part of the global DRO process. And so just noting here, like when you're filling out your TUE, these are some things to look for, like, oh, okay, you know, this one's not prohibited. Oh, this one is prohibited in competition, but not out. They're going to need a TUE if they're going to use that in a competition situation. They'd always need a TUE if they're prohibited in and out. And then looking at those conditional results to make sure that they're not reaching a threshold that they can't take something. From there, for the TUE, you're going to submit it. You're going to start to go through this pre-check form. It has the athlete information, the substance name, the treatment duration, and all these different checklists that you can kind of go through that USADA guides you. And then you fill out the application. So you, again, here's kind of the process. You find it, you look at the list of conditions, you see if you need it, you download that TUE, you complete it. And one thing of really note is the more detailed information they can provide, the more likely they are to get approval. So they really need to have very clear, careful documentation. Any tests that indicate that they need to be on that medication is really important. So you as the provider, being very careful and detailed to put in very good supporting information and any studies that would validate why they need to have that. And the review, send it in. And USADA is really helpful. So if they need support, you need support, call USADA and they can help you walk through it. The renewal process, this is important because I think that sometimes people turn their TU and they forget they actually have to renew it. So they will get an email in advance, 60 days that before it expires, that they need to fill it out. You do a new TUE, you update any medical notes, you can include that previously approved TUE, review the application and submit it. So this is like reminding athletes who kind of are like, oh, I've got it approved, to make sure to continue to look for that expiration and resubmit it. An emergency TUE. So important to know, always, always, always get medical care first. So I don't want any athlete to be in a situation where they're like, oh no, I don't want to receive that medication because I'm an athlete that's going to compete potentially in the Olympic level and with NGVs. Get the treatment that you need. They do then need to do an emergency TUE. And so they're going to basically complete the TUE form, put emergency on it. This is where they really want to be able to pull any documentation, not that they're thinking about an emergency situation, but being able to make sure you have a copy of medical records and anything that they can get completed before they leave the hospital is really great. So you don't have to go backwards and find it. These usually get approved if there's necessary need for them. I think the most common example I'd say is in like a dehydration situation where somebody goes in. That's about the only way you can get IV fluids without it not being approved. So you want to be like in a hospital setting. Surgery, if you know you're having surgery and you know you're going to need to like have something that's prohibited, then submit your TUE if you can. If it's emergency, obviously you will do that on the other end of that. But get the surgery that you need to get. So as far as anti-doping rule violations, these are called ADRVs. So there's different kinds of anti-doping rule violations. There are ones that there's a presence of a prohibited substance, basically the positive test. And then there's non-analytical anti-doping rule violations. I think this is important to know because these are things that may involve things that are not necessarily a substance, but interfering with the process. So things that we think about, and I think this was one thing that I found really interesting is that when talking to our anti-doping person, that a lot of people just kind of aren't aware that there's these other ways that you can have an anti-doping or doping violation. So that's tampering. Well, that's kind of obvious, right? But tampering, complicity, trafficking, hopefully not. That's horrible, but we know that happens. Evasion and administration, prohibited association, and whereabouts failures. We hear about that one, but there's lots of other reasons you can have a prohibited a violation. So then moving on, kind of finishing up with the role of the medical team. So out of competition, as a medical provider, I think it's really important if you're involved with high-level athletes, even at a university level, if you have some people who know are going to be competing at that level, know that prohibited list, know how to access it, know how to look for it. You don't have to remember everything on there and memorize it. That would not be possible. Use your resources. So Global Dro, use USADA. They're really friendly if you call them. Know information about supplements, know where to be able to have knowledge yourself and to be able to guide your athletes of where to go. Collaborate, work with the national governing body, work with your university. If they have high-level athletes, make sure that you are reminding them that we need to be mindful of things that they are taking and letting them know that comes up a lot for us, with athletes who are just entering into a higher level, that they come from their university and they're like, this was fine there. Why isn't it fine here? And so knowing that you want to look on that Global Dro site and collaborating with people who USADA loves providing education. So really using that, and certainly other medical providers that may have had experience here. And then education, connecting with your athletes, providing them resources, talking to them, pulling up that website, showing them how to do things so that they are informed. So in competition with drug testing, I would say it's just really important that you understand what's going to happen there. So if you're at a competition, where is the doping control room? Where is that going to take place? What have they told you about when drug testing is going to happen? How are they going to notify? Know your surroundings. I always try to figure out where is that notification happening? Where's the room? Where can I meet my athlete? Reminding the athletes that we're there to be able to support them. Make sure you remind them that they bring an athlete representative and they have that right, and reviewing those rights that they have so that they're really clear, and being an advocate for them. So a couple do's and don'ts. So when you are there, if you go to drug testing, you do not want to be an interference, right? So when you are doing drug testing, do be friendly and respectful. Make sure the athlete has what they need. Make sure you're advocating for them. If you see something that doesn't seem right, then look into that. You don't need to cause any type of scene, but if you're noticing something that doesn't seem to be moving well in that area, then feel free to ask questions. There's always a lead person ask clarifying questions, be just curious about the process, and be an advocate again. If it's really like a situation, then you may need to find that lead doping control officer so that you can really get the support you need. So just don't get in the way, try not to interrupt, let the process go smoothly, and be supportive. There's a really cool program that was made in collaboration with USADA through Stanford, and it's called Health Pro. It's an educational resource. You can take this course. I believe you get CME credit for it, and it kind of walks you through, well, most of the things we just talked about. And there's some other resources. USADA is really working hard at advocating for clean sport, and so there's now athletes or anyone can actually, in the spirit of clean sport, anonymously report, submit a tip. And that's been really great for our athletes to know that they have that ability to kind of send that information, because certainly they may be witnessing things that they may not feel comfortable reporting or being known for personally, but they can do so anonymously. And these are just some of those resources there. So this is like alphabet soup, so I just put it there. There's USADA and NADA and WADO. You can look at those later, but I kind of put them there because I feel like when you're looking at these, it can be really confusing and overwhelming. Okay, actually, so Matt, do you want me to, there's some questions for you guys. I can't see you, so let me see if I can bring this back. Can I go ahead and ask those, and then you guys can like chime in, or what's the best way to do that?
I think a good way is we can read the question and the answer choices, and then people can enter their answer choice into the chat. How does that sound?
Yeah. So kind of hinted at this. What is the name of the NATO for the United States? Got an answer in there? I might roll with that. So we just keep moving and have some time. You're right. That is correct. The answer is, oops, sorry, wrong button. So yeah, the U.S. Anti-Doping Agency. Let's move on. I mostly put that in there to confuse you with all those words. Oh, I need to move myself a little bit. So John is on the track and field team at your university. And hopes to compete in Olympic trials next year. He takes ADHD medication, says he has it on, it's approved by his university and everything's on file. He's planning to participate in this national governing body NGB qualifying event. Can he take that medication? I hit the wrong button. Okay, sorry. Hopefully you saw that. Yeah, okay. You're right. So the answer is correct. It's B. That is actually, that comes up a lot. And I would say be really mindful of that. Know that the NCAA rules and the USADA and WADA rules are not completely aligned. And so there are some different forms and paperwork that you can just submit through the NCAA that is for USADA. So if you have an athlete that may be on an Olympic pathway, make sure that you're really referring to USADA, WADA, and using that global DRO. Okay, so Willow is competing for some US national team, and it's part of the registered testing pool, so they're subject to being tested. And sadly, she ate some bad shrimp and had food poisoning. She ended up in the ER and required IV fluids. What should she do next?
Is this where you do an emergency TUE?
Yeah, you're right. Perfect.
Follow-up question for that. Does it matter whether she is in or out of competition?
No, actually. And so we had this happen with us actually in Tokyo, that there was an athlete who had food poisoning, not Willow, and had received IV fluids in the context of an emergency setting or an urgent care actually. And we ultimately, it ended up being that we were super cautious about it. They didn't care, quite honestly, in Tokyo. They were like, whatever, like she wasn't here yet. But I think you just want to get in the habit of always submitting that paperwork, because technically they aren't supposed to have more than the total of 100 milliliters of fluid. So I would always be really careful, get that documentation and submit it. That situation, I've never heard of it being denied. I see something in the chat, which might be from Mark. So yeah, I would always submit it. I think it's better to be safe than sorry, because you know what happens? People put things on social media and they're like, this was me in the ER. And then you saw it, people were like, oh, like, did you fill out a TUE? Like, you just announced to the world that you got IV fluids. So yeah, that happens. You guys might be aware of somewhere that happened during a couple Olympics ago. Let's see. So how do I find out athletes? How do I find out if it's okay, or for you, how do I find out if it's okay for my athlete to take a medication? Okay, I'm gonna accidentally, there we go. Yay, okay. That was really just if you like listened. Global drill, I love, oh, actually, right. It's, this is a trick question. You all were right, because you can look at any of these. My recommendation is you use Global Drill, but quite honestly, you can look on any of these. So WADA, that's where Global Drill builds its list from. USADA website will take you to Global Drill. It has documents from there, and then the USADA reference line. So you all are right, no matter what. Okay, how about this one? This supplement says it will help me with recovery. I checked the label and everything looks okay. Can I take it? What would you tell your athlete?
Probably that we can't confirm what's in the supplement, right? And that we advise not to take it.
Yeah, I would agree. So you actually won't find, and I didn't say this before, you won't find supplements on Global Drill. That's sort of true. I mean, I think I've looked up iron before and it will pull things up there, but you can never be sure if a supplement is free of contaminants. So I kind of use the stance of like, like if it's something that is like really commonly used, then they should really use a that is NSF certified. And that's part of that work is being done is like our supplements, we do recommend, like we recommend iron. So it feels weird to say don't take supplements, but by the way, you should take iron. So that's why there's this little bit of a contradiction where people are really trying to work on like, how can we make sure that there's clean sport supplements? I think one of the keys I was trying to mention here is that like when somebody says like, I'm taking this for recovery, it says that it's fine. That's concerning. And actually, when you look on the supplement page, it will give you things that like are examples of when you need to be concerned, like quick recovery or like fast muscle building. Like there's some key words that are there. But you do want to kind of take a chance of always being really careful of giving any like, yeah, that's fine, because if something happens, they're going to come find, they're going to identify that like you gave them that information. So it's good to see that. Oh, yeah. So I think that like, again, like really just being an advocate for them. And then I think that this is a great opportunity, right? To say to the athlete, like, what's your goal? And then what's going on? Like, how can I help you? You feel like you're not recovering well? Like, like what other things in your life do we need to look at? Like your energy balance, your like your sleep, like how's your like things that we can support them with. So are there opportunities that we can help them address their concerns in ways that actually probably are more beneficial, right? Like if they're having, issues that are impacting their performance around, I kind of think of it as the basics, like eating, drinking, sleeping, their mental health, like where do we support them so that they can use things that are natural to be supported in their goal? And I think that's it. There's a ton of links, all the links on there. And then I actually don't know, Matt, like if I can send my slides because I'm happy to have you have them. And that's it. These are my kids and me in one of these slides down here. So
very cool. Well, thanks for that great presentation, Dr. Burton. I think this is definitely a broad topic that involves a lot of sub details. So we appreciate you highlighting and going into those for us. Couple
Yeah.
questions
Yeah.
that came up over the course of your talk. The first is from, let's see, Alexander Porter, and he asks, if an athlete tests positive for a banned substance and it impacts their participation for future play, what's the physician's role, if any, in that kind of restriction or return to play?
So meaning like they test positive for a banned substance that you provided, or just clarify a little bit like it. So if you, I think this comes actually a little bit later, if you unintentionally prescribe them something and like you're like, I didn't realize you were an athlete that couldn't take this, then I would absolutely like fill out a retroactive, I would fill out a TUE and submit it. Like there is some level of lack of knowledge that the USADA will allow for, right? I wouldn't publicly like say like, sure, just go ahead and take whatever you want, and then like plead that you didn't know. I mean, it has to be within reason. I think that this comes up often with the ADHD medication, like lack of knowledge, that may be that. Let's say if they're if they're not able to participate and you're still caring for them, then like they're still going to be training, they're still doing their activities, and you're still supporting them in that way. But I would say anything you can do to provide documentation that the medically necessary medication, if it was something that you prescribed, then that's important. And I would submit it and talk to the USADA people, and that may help their sentence. I mean, a lot of those situations end up, if they're not like obvious violations, they being things where they get like this like public notice that's on like their site. You can actually, if you go out a site, you can see all these like public notice of sanctions. But I don't know if that actually answered the question. Can you clarify?
That's about as much detail as I have, and I think maybe another way to think about the question too is it's never the team physician's role to restrict play, right? If that's what these governing bodies are there for, like USADA and WADA and that type of thing. You mentioned that they're responsible for creating the rules and also enforcing them too. So
yeah, you're never going to be in the situation where you're saying, I mean, I think you want to guide your athletes. If they are honest and they tell you that they're planning on taking something, then I think you want to let them know that that's not appropriate. And I mean, I think I have never had that situation actually happen, right? Because I think I'd be the last person they would tell, because I think that they probably know as a physician, you have some oath that you would actually need to be, you could potentially report that, right? Even through the anonymous line.
yeah, certainly. Okay, we got a thumbs up from Alexander on
that. Okay.
But,
and then I saw one more.
Yeah, I think you kind of already answered part of Sierra or Ciara. Sorry if I'm mispronouncing that. Part of their question in the retroactive TUE, but how long would you say that it typically takes to get a TUE approved, and is there an appeal process?
Yes, to both of those. So it's, well, you know, I think that they say that the TUE process is really quick. Quick to me varies. I feel like it can be like, it actually can, I think that they say it's like 3 to 5 days. I can't actually remember. It can be longer, but I think what I would say is that like if you have an athlete who, because this situation happens for us a lot at our nationals, they submit the paperwork right away if they're taking something that even though they just declared. And it does feel like it's pretty quick. It's, I think it's longer. It's within, I'd say a couple of weeks, but I think that they actually say that it's shorter than that. And then I would reach to USADA. Like if you have a situation like, oh, my athlete just competed and they're taking spironolactone for their skin, then I would like turn in the forms, call USADA. What do I need to do? Make sure that you did everything possible to like support the documentation. And like the way identifying that you realize, well, your athlete's doing it, you're supporting them to do that. So they do approve those at times, but they, you know, to be the right conditions. It's not like you like get a freebie. Really. It's more that like it's almost like lack of education around the process allows you to like have that opportunity to fix that.
That's helpful to know. And I think kind of the last question that we have is, Just to clarify, you go on global DRO, you look up a substance, it's in one of those red categories where it's banned in and out of competition. Um, can you still apply a TU? Can you still submit a TUE for that substance as long as it's like a prescription substance, right? Obviously, you're
Yeah.
not for like you mentioned, cocaine or other illicit substances, but yeah.
Yeah. Well, there's certainly situations, right, where you have athletes who are taking prohibited substances because it's part of their treatment. I've had an athlete before who was taking testosterone who had had testicular cancer, and like, you know, or there may be something that they're taking that is like for a medical condition. So you can you submit all your paperwork and you get approval, and then that's the purpose of the TUE. You want to have a TUE. Ideally, you take your time, you get the TUE approved before you're in the situation where you're like, oh no, I'm taking something that I can't have. But yes, like if it's medically required, you should certainly apply for a TUE. And if you're taking something that has an alternative, sometimes they will suggest that like is there another option. But if there's something you have to be on, like for example, those blood pressure medications, if you be on that, if your athlete needs to be on that, and they also are in that sport, but that's the medication that's working best, then like that's important, right? So you're going to do what you need for your athlete and fill out the proper documentation.
Okay. Well, that's great. I think, we're past an hour. So, again, thank you for that wonderful talk. And just a reminder to everyone about the link that Andy posted in the chat. We're always looking for feedback on the series. Thank you again to both the education and fellowship committees for their support, and to Andy as well. So have a good night, and we'll see everyone next week.
Yeah, thank you, everybody.